Good morning, Dr. Joshi. Can you hear me?
Hello, sir.
Good afternoon. Can you hear me?
Good afternoon. Yeah, you can. You are audible, clearly audible.
Okay.
Dr. Pavan Folane, sir, he's handling the technicals. He's
Sure.
with me here only. Dr.
Okay.
Pavan is there.
Right. And I have just switched on my
Very good
video.
afternoon,
So
sir.
very good afternoon. It's morning for me, 9 a.m. Very cold, but I'm here.
Yeah. Good morning. That will be.
Yeah. So I think I am able to share my screen. So that's good.
Our campus director, Dr. K.R. Biani, sir, he's also with us. Principal,
Okay.
Dr. R.H. Kale, sir, he's also with us.
Good afternoon, everyone.
Good afternoon, sir. Good afternoon.
Good. In fact, I was just speaking last night with one of my very close friend who is a lawyer here in London, and
Okay.
he's from Buldan, I think, Chikli. So I was just telling him, yeah,
Okay. That's so nice.
yeah.
His good name?
Sushil Gaikwad. So
Okay.
so he has been living in London for quite some time, I think more than probably 15 years, and very closely associated with Maharashtra under London.
Okay. That's nice to know that a
Yeah.
person from Chikli is heading at Maharashtra Mandal.
Yeah. And Dr. Joshi, I was speaking with Parvati, so I have
Okay.
forwarded her Zoom invite. She also wanted to join just to listen.
Okay. That's good.
Yeah. So, I think I have my presentation open. So once you give me a sign or someone, I'm happy to share my screen and we'll start.
Yeah. Just a couple of minutes. We'll be waiting for some more to join.
Sure.
Only 25 around they have joined till now, and they are
Sure.
joining fast.
Yeah.
Initially, there will be an introductory session. Sir will introduce you, respective campus directors.
Yeah.
And then we can start with your talks.
Sure. I was actually looking at your website, and I think it looks like a very good, nice campus. So,
Thank you for your appreciation.
Thank you.
So actually, we have 4 institutes, pharmacy institutes.
Yeah, I was really
Yeah.
very keenly looking at, and I think the placement percentages for the last 2-3 years, B.Pharm student. So
Also
very
good.
impressive, very
Right.
impressive record. Yeah.
Arti ma'am had joined, I think.
Yeah, Parvati. Yeah. So
Yeah.
I do not know if you are able to unmute her, and maybe Parvati.
Yes.
Hope you're okay. Yeah.
Parvati ma'am.
Arti. I think that's
Arti.
what.
Arti ma'am had joined.
Yeah.
Yeah.
So if you can please unmute
Pawan sir, please unmute Parvati, Arti ma'am.
Yeah.
She has put a message in chat box.
Yeah. I think she's changing her name. So.
Right.
Hi, everybody. Parvati here.
Hi, Parvati.
Good afternoon.
Sorry, I'm not. I was trying to unmute to reply to Bhav's message and I couldn't. So thank you, Bhav, for calling me out.
No. Thanks, Parvati. So hopefully, I think you can, how I should say, see how I present and probably.
Absolutely. That is the reason. That is the reason I wanted to listen to the session. And of course, Bhav, there's lots to learn from you as well. So I'm looking forward to this conversation.
Yeah.
And Dr. Joshi, nice meeting you over this call. And I look forward to speaking next week.
Yeah. Thank you, ma'am. So we also have our campus director, Dr. K.R. Biani, sir, principal, Dr. R.H. Kale, sir, and all the faculty members are also over here. So it's a good opportunity.
Everybody.
Hello.
It's a good opportunity for all of us to meet you people.
Yeah. I think that's the advantage of technology. Even though we're
Right.
1,000 miles away,
Right.
we can still, achieve the conversation which we used to have in person a few years ago.
Fine. Yes.
Yeah.
Sir, shall we start? Dr. Kiarbiani, sir?
Yes, no problem.
Yes, sir. So, good afternoon, one and all present over here. So, it's again one more organization from Anuradha Group of Pharmacy Institutes to take it away high to the academic excellence. And continuously throughout the years, we keep on organizing such sessions, maybe offline, maybe online, and many technical programs even. A couple of weeks ago, we had a conference, international conference on AI. Prior to that, we had an hands-on training for the students on HPLC and all those techniques. So continuously, we are keeping it right from the beginning of session. So it's a great opportunity for all of us to have a great personality like you, Honorable Bhausaheb Patil sir. He is the speaker for today's session. And today we have organized this webinar on a very, what we can say, contemporary topic, and that is from pills to platform, how technology is redefining the pharmacist career. So pharmacist is not now limited merely to pills, and the technology is taking him to platforms. So that platform technology, which forms an important part of pharmacist skills nowadays. So we are very hopeful to hear from Honorable Bhausaheb Patil sir, who is the head operations IQVIA for entire United Kingdom. So at the outset, I welcome our speaker for today's session, Honorable Shri Bhausaheb Patil sir, our campus director, Dr. K.R. Biani sir, who always guides us to organize such events, Principal Dr. R.H. Kale sir, Principal Dr. R.R. Pagore sir, and all the faculty members and dear students who have joined this precious and important webinar. So before we start the expert talk keynote address from Honorable Bhausaheb Patil sir, I would request our campus director, Dr. K.R. Biani sir, to introduce our guest and welcome him, although online, to the Anuradha campus. I invite Dr. K.R. Biani sir for his welcome address.
Thank you, Doshi sir. At the outset, I welcome Honorable Shri Bhausaheb Patil sir for this online webinar. As Doshi sir told, this Anuradha College of Pharmacy, it represents four different pharmacy institute. Out of these four, three these are situated at Chikhli place, which is a Tehsil place, and one the fourth one is at Khamgaon. All these four institutions are in Buldhana district, and Dr. Kuchekar sir, now he has given the reference of this Honorable Bhausaheb Patil sir, and today I am very happy, I feel very proud that Dr. Patil sir is with us. So when I gone through his resume, so really it impressed. His journey is very inspiring. Sir is now a senior director, strategic operation in IQVIA at United Kingdom, England. He is an advisor of BSCER, non-profit organization, which is in Pune, India. He is a member of the board of studies in Ghaziabad in Kite Group of Institution. I think Kite Group means Kalinga Institute of Engineering and Technology, Ghaziabad, India. Sir is a member of Industry Academia Board of Krishna Institute of Pharmacy, Karad, and presently working as a STEM ambassador in collaboration with UK government and educational establishment. He is a clinical research leader, operational excellence, predictive quality management, is working in innovation, connecting data to get better insight and process transformation through deep learning. He has a very inspiring journey. He has started his career journey in a clinical research from a local clinical trial assistant to a global role to promote patient safety, data integrity, and regulatory compliance, and to bring a new medicine to the patient faster and safer. Sir has completed his post-graduation, I think, from Government College of Pharmacy, Karad, and Sir has received an excellent opportunity to enter in the field of clinical research in India when the international clinical research was gaining momentum. As I told, Sir has 29 plus years of experience working on various roles within IQIA as well as legacy companies, that is quintiles. Sir has received an excellent opportunity to attend a residential middle management development program at one of the prestigious institutes, Indian Institute of Management, Ahmedabad. During the last means he has worked in India, in Singapore, in Vietnam, Malaysia, Indonesia, UK, even USA, and many more countries. He has traveled across all the continents and made numerous professional networks in the number of countries around the globe. Now, Sir has conducted 250 plus GCP sessions and the workshop for investigators and ethics committee in India, Asia, and 400 plus career development sessions for pharmacy and life sciences students in Asia and the UK. One of the most recent workshop on clinical research was attended by more than 1,500 students in India, which was held in Feb 2023. Sir is actively involved in contribution to the introduction of the STEM role models into the school as a part of STEM ambassador program in collaboration with the UK government. Sir is associated with BSCER, a non-profit organization, as an advisor. Sir is recently appointed as the industry representative of the Board of Study for Pharmacy Curriculum by Kalinga Institute of Engineering and Technology, Ghaziabad, India, as well as Krishna Institute of Pharmacy, Karad, to advise on curriculum development and industry trends to ensure that the university program meet the highest standard of relevance and the excellence. Now, Sir has this inspiring journey, and on behalf of Anuradha Group of Pharmacy Institute, at the outset, I take this opportunity to welcome Honorable Shri Bhausaheb Patil Sir for this online platform. And on the behalf of, I also extend my thanks to Dr. Kuchekar Sir, who has given your reference. And really, Sir, your journey is very inspiring, and we will be very happy in future also. We want to join you regularly. We will invite you, and as and when possible, it will be our request that whenever possible, you spare the time and time to time contact our student and faculty to motivate, because you are one of the pioneer of clinical research and pharmacovigilance. At this time, I want to share that Anuradha College of Pharmacy, since last 5 to 6 years, we are also conducting one certificate course of clinical research and pharmacovigilance with the help of the different experts from the industry. So, clinical research and pharmacovigilance, it is a very thirsting branch. There is boom is there. So, definitely, so many students, they are interested to do their career in the clinical research and the pharmacovigilance. I once again welcome Honorable Shri Bhausaheb Patil Sir for this virtual platform on behalf of Anuradha College of Pharmacy. Over to Doshi Sir.
Thank you, Dr. Biyani Sir. So, while Dr. Biyani Sir was introducing Honorable Bhausaheb Patil Sir, very correctly he told that the journey is really inspiring. Right from a small place in like Karad, and you have flown to London. Definitely, your presence and your guidance, your words, they are going to boost the morals of not only the students but also the teachers. So it will be quite exciting to hear from you, and quite we will say that it will be a great boon for the students. So without taking much of your time, may I now invite Honorable Shri Bhausaheb Patil Sir to begin his keynote talk. Honorable Bhausaheb Patil, sir, please.
Thank you very much. And what I wanted to do, let me just make sure before I start. Are you able to see my slides on Zoom? And can you hear me okay? And also, are you able to see me?
Sir. Yeah, you're clearly audible, and the slides
Okay.
are also equally clearly legible.
Yeah. So, first of all, very good afternoon, everyone. Respected Dr. Biani sir, Dr. Joshi, Dr. Kale, and I'm sure I'm missing quite a few names. It's 9 a.m. in the morning in UK. And before I start, I would like to request all the audience, if you really would like to keep me awake, please ask me loads of questions. I'm slightly sleep deprived, had finished my work quite late. Not that I'm complaining, but that's who I am. I enjoy what I do, and I take very pride in saying that. So I have few slides, and I was speaking with Dr. Joshi sir a couple of days ago. So first of all, thanks to Dr. Kuchekar sir for establishing that connection. This is my passion. Whatever little bit I learn in the last 30 years of my career across different geographies. Uh, what I want to achieve at the end of this session, to inspire some of you, and start thinking big, and also sort of decode some of the nuances, as rightly Dr. Joshi said. I come from a very small village, not even Karad. It still has like population of 1,500, and even during monsoon, the Maharashtra buses do not ply on those roads. Unfortunately, road conditions are so bad. Why I'm saying, I think this is a common myth. Everyone thinks, if you want to be on an international platform, you should be from city like Mumbai, Pune. You should be fluent in English. You should be looking good, and you should have loads of money. And very honestly, I had none of them. And taking fast forward 30 years, I have some of them. Although, and then maybe I may not be looking good, I may not have good English, but I still have sort of managed to this level. And I think everyone can do that. If I can do that, 30 years ago without having a mobile laptop, many other facilities which you have, I'm sure you can do a lot more, and hopefully I will decode that message as we speak. So I have few present slides to guide our discussion, but I'm not intending to go through all of them. If you have questions, type them on the chat. If you are able, unmute your line, ask me those questions. uh, I also want to give another example. I was speaking with Dr. Joshi, just giving example from Buldhana. One of my very close friend, Mr. Sushil Gaikwad, if you Google, he is one of the prominent lawyer or legal advisor in UK. Lives in London. A very good friend of mine. He is the trustee of Maharashtra Mandal London, which was started by Dr. Baba Sahib Ambedkar, and I think we will be completing 100 years since it was established, just in another 5-6 years. So that's, I think it is one of the first, or not one of the first Maharashtra Mandal outside of India established that time. And he is the trustee. He comes from Buldhana, and if I'm not mistaken, he's from Chikli. The reason I'm saying, in 2006, 26 July 2006, probably some of you may remember, there was a major flood in Mumbai. He came with a small bag in his hand at the airport, and then he made his way to London. And now, he has become one of the prominent legal solicitor advisor in London. Again, this is another example. If he can do it, many of you can. So, what I want to do, my talk, I said, it's like from pills to platform, how technology is redefining pharmacist career. And those who are interested, at the bottom right, you will find one QR code. Feel free to scan it. Connect me on LinkedIn, and you will. I usually write some blogs, or put some of my thoughts, in case and I also have passion to sort of provide some information based on what I know including, currently there is an AI summit which is going on in Delhi with lot of things happening. And just today early morning, I was reading a major AI in healthcare reform policy being introduced by Government of India, very, very prominent. So why I'm saying that, and I want to ask you a question. So of course, they is, so before again I start, this is a small QR code I will share towards the end, and Dr. Joshi will also share this in your WhatsApp or email group. I would like to hear, your feedback on the session, because as I said, I do conduct these sessions globally, and I would like to learn how I can do better. So, it is a small 2-3 minute survey. So feel free to complete at the end of the session. The few, I think, the slides I'm going to present, there is a disclaimer. Again, I work for this organization, IQVIA Legacy Quintiles. I spent all my life. So in fact, if I look at my journey, just in another precisely 10 days, I'll complete 30 years. Uh, I think, the thoughts presented in these slides, they are my own thoughts. Again, it is just a disclaimer. Now, that doesn't mean they are not right, but I am speaking on behalf of myself. I'm not representing the company. So it's a bit of a disclaimer. They are my own views. Before I go ahead, I want to ask a question, and I think probably, I'm sure when I was speaking with Dr. Joshi, some of the previous presenters who presented topic of AI, there is a lot of buzzword about AI, and I would like to decode that in a very, very simplistic way. But how many of you think, and you can use the chat function, how many of you think artificial intelligence or technology is going to take our jobs? And I would really like an honest answer. If you just use the chat and just say, yes or no, or maybe. So how many of you think artificial intelligence is going to take our jobs or taking our jobs now? And I'm just looking at the chat as we speak. Let me go through that. I think Professor Joshi saying nope. I also see Mitali saying no. AI can't replace human. Dr. Joshi, you are saying. Anybody would like to think AI is going to take our jobs? Again, please use chat function. I know, I think your lines are muted. Uh, Parvati saying yes and no. Very interesting answer. Professor Swati Kerekar, no. So I think, probably I would like to again, elaborate more on that, and probably, hopefully, you will answer that question yourself. My next question, what you see on this slide, and it's a nice segue. If you think about, India has about 1.4 billion population. So if I have to translate that in a very, very simplistic way, one out of every fifth person living on the planet is Indian. So there is close to 8 billion population globally, 1.4. And I think this is where you can imagine another advantage of Indian population. Out of that 1.4 billion population, majority of that population is young, which is not the case in countries like Japan or UK, where the majority of the population aging population. Now, aging population, again, do not take it in a negative way, but those are the population which is not productive. Probably that's a disease burden on those countries. Having said that, India is not something, we say disease free. But if I have to ask you a question, why do people generally die? And if you have to name the major diseases why people die, say, like, which disease comes to your mind? Any, again, please use chat function. And if you can just give me your answer, say, what is the main reason why people die because of a specific disease? I'm just looking at the chat. Accident, I think Dr. Joshi is saying, Mitali saying cancer. Uh, Anybody else? If you, again, this is just the guess, and I'm going to show you some real hard statistics, which is diabetes. Again, Dhanasri, you are saying, like cancer. So again, if you think about, this is the data I pulled out from the world statistics, which is more like a credible source, and this is the data from 2019. Of course, they publish the data every 4 years. I have similar data in 2022. I'm going to show you that. But what it shows, if you look at globally, I think in year 2019, there were about 55 million deaths. So, if I translate that 55 million, it's about close to 5.5 crore in Indian context. So these deaths occur globally. And if you look at the top 10 causes of death, the first one is heart disease. Almost one out of in every three deaths occurring globally, they are because of cardiovascular complication. And the statistics is very, very sparkling. So if you look at the average deaths per day, 50,000 people are dying. So as I speak right now, every 2 seconds, someone in the globe is dying because of cardiovascular complication. It's that serious. If you look at the cancer, close to 30,000 deaths globally. So almost like, every 6 to 15 seconds, somebody is dying because of cancer. And I think that's the huge disease burden as a society we have globally. Now, why I'm again saying this? Again, this is an area where a lot of research needs to be done. Although we say, we have a lot of medications, new research ongoing, still there is a lot of unmet medical need. That's number one. And therefore, I would really like, if I ask you honest question, including myself, why did I join pharmacy profession? My honest answer is, I tried very hard to get into a medical school in 94, in 1990, almost like 35 years ago. Didn't get good mark. My father was a secondary school teacher, didn't have enough money to send me to a private medical school, and therefore my only option was find out something else where I can study, and I joined this government college of pharmacy Karad. So it was not by choice, but it was more. But coming forward, I would really like to thank myself. I made that decision, and I would like all of you to go back with that mentality. Don't ever think that pharmacy is a substandard profession compared to medical engineering. Till the time there is life on earth, our services are going to be required. And this is just one of the example. And again, if you look at that 33% of people dying from heart disease, majority of those deaths are coming at a young age, where and then you are hearing those news in media right now. Somebody died at the age of 40. Even in UK a couple of weeks ago, I was giving a talk at one of the school in UK, as a part of my STEM ambassador for class 12, class 13 students. And there is a association in UK called as CRY, CRY, and it's really CRY. And what does that mean? Cardiac arrest in young adults. Almost there are about every day between 8 to 15 children's between the age group of 20 to 35 years are dying, suddenly dying, and we still do not know cause of the death. So that's how serious it is. And so I think therefore a lot of research needs to be done, and hence who is going to do that research? People like us. So again, and if I give you another example, just a few years ago we were grappling with COVID during year 2020, 2022. Majority of the industries, like the airline industry, you talk about hospitality industry, the hotels, they are completely come at a standstill, because the flights were grounded, hotels were empty, and there was only, I think, the one profession was continuously working round the clock, and that profession was sort of a medical paramedical. Doctors were busy in treating the patients with whatever they had available, and more importantly, they were relying on people like us. Can we come up with some cure to treat this deadly disease? And this is where I think, I'm proud to say, people like me, we were working almost like 18, 20 hours a day to find out if there is a cure we can bring in for vaccine. Now, when I say that, I'm not saying probably like, I was solely responsible for, bringing some of those, cure. Maybe I was one in those, tens of thousands of researchers who are working on that. But I really feel proud that, we as a pharmacist or researcher are the reason why people are living the way they are living today. We come out of the room, we come out of the, and, we got vaccinated, and we were able to, get rid of that disease. So I think this is another example to why I'm saying, never ever think this is a inferior profession. Now, switching back, this is a global data, but if you look at on the right hand side with those arrows, uh, India has the burden of what we call as the diseases of developed nations, like cardiovascular cancer. However, we still have the burden of those traditional infectious disease burden, like the tuberculosis or malaria, and almost you can see like there are 14% people died because of those diseases. And I think that this is so India is uniquely placed. On one hand, we have lot of young people, a lot of talent available. On the other hand, we have the burden of developed nation, like people are dying at a young age, where you are supposed to be productive, you are supposed to take care of your family, you are supposed to earn, and during that process you are also supposed to pay taxes to the government, and that's how the government progresses. And on the other hand, India also has burden of some of the infectious disease burden. So I think this is again, I'm not saying this in a negative context, but this is a huge opportunity for us to do something about it. So if you look at this another slide, just this is another hard data. Again, I pulled out and just analyzed what it shows. If you see, the causes of death, of course, cardiovascular disease. So you have on one hand the global burden, but how India fares. And if you look at again, what I was saying a while ago, India's disease burdens almost like in the top 10 diseases. It is almost similar. However, if you look at the kidney and dementia, it comes as a top 10 diseases in a global context. It's not the case in India. Again, why dementia usually get impacted at an elderly age. So maybe it is going to happen in India as people start living longer, not necessarily healthier. But that is the current state right now. If you look at, on the other hand, tuberculosis and diarrhea related diseases, India has that burden, which is amongst those top 10 diseases. So I think this is just an example. India's dual burden: communicable and non-communicable diseases. We still have, unfortunately, limited healthcare. And I think this is where I would like to believe, just bringing that, if somehow as a pharmacy profession, if you start learning about how I can use the technology and speed this clinical research, possibly we may be able to help bringing cure for some of these diseases much faster than what traditionally research industry has done in the past. And I'm going to sort of take a bit deeper dive when I asked you that question earlier, and even as a part of this national education policy NEP 2020, I have seen some of the curriculum in India. Everyone talks about, as a pharmacist, I need to start learning Python language, or I need to be a biostatistician. I start learning, and quite honestly, do you really need to do that? I have my different views. I think what you need to understand, AI is not a new term. It is just kind of a buzzword introduced in the industry for the last 2 years, and everyone starts thinking, oh, like it's something I don't know. But as an industry, or if you look at since 1950, the first term of artificial intelligence was introduced in year 1950. Now, for the lack of time, I'm not going through that because Dr. Joshi sir has mentioned there was another talk.
Sir, excuse me to interrupt you, sir. You can
Yeah.
take your own time, sir.
Okay. No.
There
Again,
won't be
I
any
just want to
limitation
make.
from our side.
Yeah, yeah. So I think and probably I haven't added that term, but almost in 1950, the first use of AI was introduced. Again, in the medical school, the first use of artificial intelligence was introduced in 1976. The ophthalmological related procedures, if you look at the first use of artificial intelligence, it was introduced in year 1980. And I think, so there is long history. I think it is just a new term we have given, and if all of us start. So if I have to decode that AI word, I will come back to you in a minute. But I think this is where I would like you to go away. While AI is a buzzword, don't ever think that you have to learn language like Python. Don't ever think you have to learn, be a good statistician. But make sure you try and understand AI in relevance to your job. And if I have to say that, it's about critical thinking. Be curious. Again, as I said, like, cardiovascular, like, now why people die at a young age. What is that? And, maybe simple reasons could be, do I sleep adequately? Do I do enough exercise? And I think, maybe it looks too simplistic, but when you start asking those questions, be curious, you will find an answer. And that is what research is about. That is what is critical thinking. And if you are thinking from that point of view, you're going one step closer to artificial intelligence. So just, keep that in mind. And what I would like to say, definitely artificial intelligence has a huge potential to help speeding clinical research. However, please remember, artificial intelligence technology is not going to do that on own. They will still need to be supported by human. And there is a term, I was just reading an article released by Microsoft just about 6 months ago. They are, looking at, artificial intelligence concepts in health, but, it requires the domain experience, and that experience is going to come from people like us. So I think my message to you is always be curious, understand, AI relevance to you, not necessarily, looking at how I can learn Python language. So if you stay and close to understanding that, it will help you to get a job. Those individuals who are just relying on the current knowledge, which is in the textbook, I feel they're not going to progress. So what I'm trying to say, AI with your domain experience is the future. Only AI is not going to make the future. Only textbook is not going to make the future. So if you stop learning, somebody is going to take the job. Who is going to learn how that AI relates to your profession? So that's my message to you. Now, just going back to I actually, about a year ago, usually, I listen to, some of the talk every quarterly. Most of the CEOs of pharmaceutical company, they release their quarterly earning financial results. And as a part of that, they also provide their strategy. And this was actually, if you look at, as at the end of 2025, now most of the quarterly earning or, 2025 financial performances are being published. And every CEO, the chief executive officer of pharmaceutical company or even tech company or in any other, they have one question in their mind, how artificial intelligence can maximize their impact. Maximize impact, say, in, how the real estate industry, maximizing in impact in the manufacturing industry, maximizing impact in pharmaceuticals, healthcare. However, unfortunately, very few know how to do that. And I think that's the biggest gap. And this is where, if you have started looking at, from a financial perspective, I would strongly request, just Google search and look at some of this, those technology company or pharmaceutical company, who are talking about artificial intelligence. Uh, Artificial intelligence is a buzzword, but those who are able to translate that into their business, they are progressing. Whereas, only artificial intelligence, there are a lot of stocks which have gone down, unfortunately, because what it says, it is not important how much data you have. It is not important how much technology you have. Are you able to translate that technology in your domain experience and able to show return on investment? And I think that is the biggest challenge every industry has right now. And I would like to decode this, in relation to uh, pharmaceutical industry. Everyone talks about, I'm using AI. Everyone is talk about, I have this chemical-aided drug design, computer-aided drug design bringing in. But how many are able to do that? And this is, if you look at every new medicine which comes to the market. Take example of vaccine. I think vaccine was an exception because of the technology. But generally, if we have to bring any new medicine from the lab to the market, on an average, it takes anywhere between 8 to 15 years. And the success rate, if you test about 10,000 compounds in the lab, after 8 to 15 years, one gets succeed. Now, what does that mean? Every molecule, you need to spend, pharmaceutical company needs to spend about $2 billion US. and you multiply that 2 billion by 10,000, and after 15 years, one gets success. And I think that's the huge cost. And we have, again, I think as an industry, there is a realization it cannot be sustainable, because if you look at my previous slide, there is such a huge disease burden. Again, I haven't spoken about the disease burden of, you may have heard of rare diseases. There are about 407,000 rare diseases which impacts smaller population, but unfortunately there is no cure. And if I combine all those, 4,700 rare diseases together, very soon that is going to become a major cause of disease. Unfortunately, there is no treatment available. So if you look at, and I think there are a lot of things which are unknown, and you cannot just add on the layer of yes, instead of 10,000 compound, you add another 100,000 compound, because cost of research is going to go high. So what is that we need to do? So I think that this is where, and I know, I think somebody has raised the hand, but if you have a question, please do ask. So I'm going to just take a pause for a second. Probably no, but yeah. So
Might be
do
mistakenly.
Okay. Yeah. Okay. So now this is a 2 billion cost. So how we reduce that cost? And I think the answer is, as I said back, maybe technology can help, but remember, technology cannot do on its own. Technology needs to be supported by domain knowledge, experience from people like us. And this is where I want to ask you a question. If you think about, most of you, as I was hearing from Dr. Joshi, you will start, exploring job opportunities after finishing your B Pharma, or some of you will go for, post graduation, maybe PhD. But let's say when you finish your education, and if you're thinking about your dream company that you want to work for, which company comes to your mind first? So, just think about, this is an ideal company I want to work for after I finish my education. Which company comes to your mind? Can you give me answers on the chat? That this is the company I want to work for. It's my dream company. Can you type in the chat and just give few names of the company that you want to work for? Of course, and it is an aspiration. So I'm just asking a question, and then I have follow-up question. Yes. So thank you, Dhanashri. I think you're saying Cipla is the company that you want to work for. Any other answers? Any? So I know, I think probably have, yeah. So Dr. Reddy's. So thank you, Dr. Pavan. Again, probably when I ask this question, even usually you try to think, based on what you know. Either now, because I think we live in India, when I ask you the question, you are thinking about Dr. Reddy's, Lupin, Cipla. If I, again, this is where think big. And when I ask think big, why you are just looking at those Indian companies? Of course, it is good, but there are many other opportunities. Sun Pharma, yes, but and there are companies like Johnson and Johnson, AstraZeneca, Eli Lilly. Now they are coming up with this new drug of, and the obesity. But how many of you have, yes, Dhanashri, International Merck and Company, but if I ask you, how many of you think that I want to work for Google, or I want to work for Apple, I want to work for Microsoft? How many of you think that is possible? And I think this is where probably you don't think that Google is a company that I want to make my career with. Apple is a company, and I think always we tend to think these are technology company, and what it has to do with healthcare. And I think this is where, again, my message to you: don't, again, always think big. Number one. Number two, again, think, don't get surprised after you complete, in 5 years. Some of you start working with Apple, some of you start working with Microsoft, developing either diagnostics or developing new medicines for the diseases where there is no cure. Look at my previous slide. And I think this is why I'm saying that is happening right now. And this is where the technology is helping. And I want to give you an example. if you think about, again, just about last year, I was speaking with a couple of, few of my medical friends, the doctors, and what they say, you know, even though a lot of research has been done, for the last, 300 years, 400 years, as a doctor, we still do not know 80% of our body. And as I said, like one of the example, this cardiac arrest in young adults, we just don't know why people die. And I think there is still a lot of unknown, despite a lot of research has been done. And if I translate that, and this is where, uh, if we have to identify a cure for a specific disease, our human body is made up of a lot of protein structure. So again, there are millions of protein structure or billions of protein structure. And usually, again, I'm just translating in a very, very simplistic way. So maybe, for some of those researchers in attending this call, you may find it too simplistic, but hopefully I just want to pass on the message and you can then correlate how technology can help in, pharmaceutical innovation. So if you think about a human body has lot of proteins, and just think about, there is one protein which gets, which has structure like straight, and because you have fever, that protein structure gets a small bend, and because of that small bend, what is the symptom? You get a fever. So if you have a fever, your natural reaction is, maybe you feel weak and you need a medicine. And what that medicine should do inside your body, your protein structure is bended like this. So probably like you want that chemical constituent to make that structure straight. And that structure can be made straight by pushing that bent protein upwards. But I think the trick is when you do that, you need to find the chemical structure which can help to push this not too fast so that structure can bend the other way down. So your fever will recover, but you have other side effect. You also do not want to have a chemical, a new medical chemical structure which can push that but too slowly, because that's not going to help, because your fever will last long. So you just need to have right force which can help to push that structure, put it in the position where it was. And that again, I'm translating. So this is where you need that kinetic energy. You need the computer-aided drug design. What can you? How many carbons you need? How many hydrogens you need? And this is what it is about. And so if you look at that, there is a company called as Google DeepMind. And there were, I think, a couple of years ago, there were a couple of scientists who received Nobel Award, and they have studied all this protein structure inside the body. So you can almost like see if one of the structure is bent like this, which chemical constituent you need to put it straight. If the structure is like this, what you need to bring it back. And so this is where in the lab you can actually test this. So you do not need to really conduct those animal toxicological studies. You do not need to study 10,000 compound. You can really find, okay, like if the structure is this like this and I need to put it straight, maybe I need 5 carbon, 2 nitrogen, 4, and then you can actually in the lab make that molecule. And so instead of 10,000, you may just need 100. And so you can see now your research is suddenly, you're not talking about 10,000, you're just talking about 100. And I think so this is what is right now. There is an isomorphic lab, Google DeepMind. They have come up with this computer-aided drug design, and now they have not come on their own. So there were scientists from like us who helped to develop that lab, and this has potential to save significant amount of time and unlock some of those mysteries of human biology, why these people, young adults, die, understand that protein structure, and hopefully bring some cure. So hopefully like this gives you an idea in terms of, while technology as a buzzword, they cannot do this on their own. You need researchers like us to ask the right question and translate our domain knowledge coupled with the technology and help bring that clinical research forward. So hopefully I think that makes sense to you. I do want to take a pause and just wanted to make sure you can hear me well and my slides can be seen on the screen. Are you able to, am I audible, Dr. Joshi? Just wanted to make sure. Uh,
Yeah, clearly audible and the slides are also visible.
Very
Very
good.
clear. Very
Yeah.
clear.
So yeah. So again, what I want to do, I think, let me switch my gears. Hopefully, I have been able to convince you, why this is an important profession, and again, with some clear, solid data. I think hopefully you also have got an idea. Artificial intelligence is an important, but you do not need to be an expert in Python. However, you need to be asking right questions. Be curious, think critically, and ask that question 100 times, and you will find an answer, because that's what artificial intelligence is about. What it does, it collates the data, and you have to ask various permutation combination. If I ask you, if you multiply 5 by 5, you know the answer 25. But if I ask you, can you multiply 50,025 multiply by 1,03,400, you won't be able to do that. Technology can do that, calculator can do that. But who has developed that calculator? That algorithm behind comes from the domain expertise in that mathematics. Similarly, if you have to develop new medicine, the example that I gave, that domain expertise is going to come from us, and then couple that with technology. So let me, give you, if I have to ask you, what do you understand by artificial intelligence? If I have to, if, let's say, if you have to explain to your grandfather, maybe who is maybe 70 years old, or grandmother, and if you have to decode that in a simplistic way, how you will explain, what is artificial intelligence? So I'm just looking for some answers on the chat. So if you can, and maybe like or what do you understand by artificial intelligence? Anyone would like to give it a try? What do you understand by artificial intelligence? Let me make it simple. So just, let's spread the word. What is artificial means? Okay, tool to act like human. AI is equal to tool to act as a human. Anyone, what is artificial means? Anyone would like to give it a try? And if you're not comfortable, type in Marathi. I can still read. I can understand. That's okay. What do you understand by artificial? It's not natural. And intelligence is, basically, so if you put these two together, you are trying to make machine behave like a human. That's again, in a very, very simplistic way, artificial intelligence is about. And I think I want to give you, there are three terms you may be hearing, artificial intelligence, machine learning, deep learning. Now, what that is about. And again, this is where I'm going back to very, very simple examples. Think critically. So let me give you, the artificial intelligence. Let's understand the first term, artificial intelligence. So what I said, again, I'm just looking at the chat very quickly. Uh, Makes decision like human. So yeah, I think, so artificial intelligence, ability of machine to function like the human brain. So there are, now I'm just, uh, sorry, I'm just going to minimize my screen. And so if you look at the first term, artificial intelligence, there are examples like, robotic vacuum cleaners. So probably, I'm sure, I think, and I have seen that in India, that even, if I have to clean my house, I can just put that robotic vacuum cleaner, and, it will find where the dirt is, and it will clean the house. It can go behind, below my sofa. It can go the below my dining table. It can clean. And so that is what artificial. So it is, in normal ways I would have taken jhadu and clean that. Now I don't need to do that. So that's the, those robotic vacuum cleaners. Uh, but again, if you understand behind, it works on a way where it scans the dust particles, and till the time, that's, if you look at the IR in front, the spectroscopy, till the time they don't see that clean image, it will keep on cleaning that part. So again,
Scanning.
it's a very, very simplistic way, but artificial intelligence is what we are telling machine. If you find those particles more than 50 particles per square millimeter, keep on redoing that task. That's how we have taught the machine, and that is what artificial intelligence is about. I want to give you maybe another simplistic example which will make sense. If my son plays cricket, and I think cricket is big thing in India, especially with this cricket World Cup ongoing. So every Friday I take my son to for his cricket coaching. And what happens, when I sit in the car, I have my Google Map navigation on my car, and I tell I want to go from my home to the cricket stadium, and it tells me like how to go. So you have that navigation. So that is what is artificial intelligence about. I don't need to worry about the road; it will guide me. So even though now think about, I did that for consecutive 3 weeks, every Friday at 6 o'clock. Now I'm using my phone and I'm using map on my phone. So now my phone started learning this particular person does the same job at 6 p.m. every Friday. Guess what happens? On the fourth Friday, my mobile said, I think, you're going for at this place. Now it won't know whether it is for cricket stadium, but it will know that this person travels every Friday at 6 p.m. from, Wokingham to a cricket stadium. So it started prompting me. There is, it will take about 15 minutes for you to reach from your home to spot B. Now, machine started learning from my behavior, and that is what is machine learning. Machine started learning, this person does this repetitive task, so let me remind him. And then it started telling me that, maybe like, so this is what machine learning is about. Now, and this is where you will suddenly find an example like Amazon or Netflix. If you watch certain movies, if you go on Google and say, if you find you are looking for a watch or you are looking for a specific book, suddenly you find on the right hand side of the screen, you get information on the next day. Oh, like, this is a new watch coming in. To the extent, if you go on Amazon right now, and maybe my wife does some shopping of clothes, and suddenly like all of us start seeing, oh, like there is a new sale going on. So Amazon can create a website customized to make your experience. So if I like watch, the moment I open my laptop, I will see all advertisement sale going on related to watch. If my wife does that, it will show all about clothes. If my son starts showing, looking at website and he has looked at previously cricket kit, it will start showing cricket related information. So that's what, machine is learning from your behavior, and it is about, machine learning. If you look at the deep learning part, it goes one level down. Now, again, giving my one example, I was taking, I was going every Friday, machine started learning, this guy goes, then it started prompting me, but then now machine also started looking at, and then in almost a few weeks later, machine started telling me, there is a traffic on the usual road you go. So therefore, if you have to leave, if you have to reach there at 6:15, you may want to start at 5:50. So the machine started looking at, it did not just learn from my behavior. It started extracting data from traffic condition. It also started telling there is a lot of rain. So do you really want to go? Because because it also started the place where I go, it's a cricket stadium. We play outdoor. So if there is going to be rain, machine started slowly telling me, do you really want to go? So here, what is happening, machine is not just learning from my experience, but machine also taking data from surrounding. And this is where deep learning is about. So now hopefully like, you understand, these are sort of, those, you can say a business jargon, but, it is all about critical thinking. And this is where now I'm going fast forward. Some of these concepts makes very well sense in a manufacturing industry. So, if I have to manufacture, say, a Tesla version, a big car, and if say like, now there is sudden demand, I can replicate same factory 10 times and increase my demand by 10 times in no time. Of course, for construction, I will need time, but I will get the same output. Unfortunately, in artificial intelligence, if you think about bringing into healthcare, you cannot do that because we have 8 billion population. And as I said, human biology of 8 billion population is different. Not all of us look the same. And amongst that 8 billion population, all of us think differently at different phase of our life. Just because, now Dr. Joshi is nodding head when I say that on screen, or if that doesn't mean probably he is listening. Maybe he has some other things going into his mind, maybe his next lecture. Just because I'm, now you feel I'm engaged, I'm speaking to you, that doesn't mean, that because my other mind also says, I have to start my office, I have to speak about this. So all of us think differently, and it is very difficult for machine to predict. And I think this is where the huge opportunity, the human element we talked about, clinician in the loop or human in the loop is extremely important. And as one of my colleague Parvati said, AI cannot do on her own. Human cannot do on her own, but bring those two together, we can do a lot. So I know, I think, probably I have spoken almost for an hour. So as I said, my idea was not to go through the slides, but, relate some of those to my own personal experiences. But, just talking about top 10 cases of artificial intelligence or, healthcare, you talk about medical image analysis. In the UK right now, if you look at those x-rays or mammogram, many times the ladies after they start the breast screening just to see if you are going to have any unfortunate complications like the breast cancer, so they undergo mammogram screening at an early age. And those mammograms are usually read by two radiologists just to make sure they are interpreting it correctly. And if you think that interpretation means critical thinking, and now what is happening, that two interpreters are, there is a trial going on. One of, instead of reading those mammograms by two radiologists, one of that radiologist is going to be replaced by artificial intelligence. We are still keeping the other one. And now what is happening, and this is a trial going on to see whether the artificial intelligence interprets in the same way like a human. Now, over a period of time, we will need to teach the machine. And over a period of time, maybe it will start doing on our own. Now, again, do you want to think that, that one radiologist will lose his job? Probably not. Because, UK itself has 65 million population, which is probably half of Maharashtra. But half of that, about half of that 65 million population is probably like roughly female. And maybe out of half, about 50%, they are at the age group where mammogram screening needs to be done. And right now there's a huge backlog. Even if right now they start doing the screening, it will take about 30 years to complete all screening, and by that time new population will come in. So just think about, if we replace one radiologist with AI, you can bring that screening period closer. It is so that one radiologist, even though he's not going to interpret, he can interpret another mammogram screen with AI in the loop. So I think, when I say AI is not going to take your job, however, the AI, the person who learns AI is going to take the job. And when I say, when you have to learn AI, that doesn't mean learning Python language. Make sure you are curious. You think about why. And also, I'll give you another funny example, and probably it will again make sense to you. When ChatGPT was launched about 3-4 years ago, there was a lot of talk about it, like, now, this is going to be the future. AI is going to take the jobs, and probably we don't need humans. And I was having a very interesting discussion in the US with some of my technological friends who work in Microsoft, Google, and it was on a very lighter note. And this was almost like 3-4 years back when ChatGPT was launched. And I said, okay, like, when we were having that discussion, he said, like, no, now look, if I ask this question to ChatGPT, it gives me answer. So probably, like, no, I don't need you as a researcher. And I said, okay, like, no, while that conversation was going on, I asked a question to ChatGPT. It was a very simple question. If it takes 1 hour to dry 15 clothes, how many hours it will take to dry 30 clothes? Now, what did ChatGPT do? They did simple math. 1 hour, 15 clothes. So for 30 clothes, it will take 2 hours. Now, ChatGPT did the simple maths, but it did not understand, if I have enough space to dry the clothes, no matter if I dry 15 clothes, 30 clothes, or 50 clothes, it is still going to take 1 hour. At the same time, ChatGPT did not understand, if I dry that clothes, say in place like Singapore or India, where, it's quite sunny, I don't need 1 hour. I can dry that in 15 minutes. Versus if I have to dry that clothes here in UK right now, outdoor, I won't be able to dry that even for a week because it's like -3 degree. It's continuously raining. So I need to dry that clothes in a dryer. So, this context, and this is what is called as prompt engineering or context engineering. You need to ask the right questions. You need to feed the right data to the machine and then ask the right question. Then only you will get the right answer. Otherwise, machine is, because this AI or these technological models, they are trained in a way, they won't tell, I don't know the answer. They will find answer for you. Some answers will be right and some answers will be wrong. And that's why it is very important as a human, you ask intelligent question and then train the machine. So, right now, if you have to do simple mathematics, as I said, example, like, 50,000 multiplied by 10,050, machine will give, calculator give you the right answer. But, that was not the case few years back. And now translate that here. And this is where in healthcare, there is a lot of challenge. On one hand, there is a huge potential, but unless it couples with domain experience, we can't progress in bringing AI in healthcare. So that's why I think, please remember, your knowledge is important. You try and develop that habit of critical thinking, and very soon, you can start talking about AI language or sit in front of a technology expert and start telling them, like, this is the protein structure, the way I explained, and I want this to make it straight. And I know, it needs 2 carbon, 1 hydrogen. Now show me which are the molecules, possible molecules. You don't need 10,000, you will need 100. And from that, you narrow down your search. So there are many companies. This is where right now you will see many companies like Novartis, Glaxo, they have started partnering with technological companies and speed the clinical research. Hence, as I was saying, if you look at Apple, they have started making Apple Research Kit. So almost like if you have to understand, if I have to understand Parkinson disease, if you remember, if you think about Parkinson disease, usually they have tremors, those patients have tremors in their hand. And if I have to understand the severity of Parkinson's disease, traditionally, that severity is measured by neurologists as using a rating scale called as Unified Parkinson's Disease Rating Scale. And what does it does? It asks questions, are you able to hold the cup of tea in your hand? Are you able to button your shirts? And, if patient says no, then they determine the severity is high, medium, low. What is happening right now, that Apple Research Kit, and I'll just give you one simple example. Apple Research Kit has an app built into phone. You take the phone in the hand, and if somebody has Parkinson's disease, your hands will start shaking. It will measure number of vibration, and that equates to, say, your Parkinson's disease rating scale is 3 out of 1 to 10 rating scale. Then that patient is made to walk, keeping phone in hand. And usually, if you think, a person with Parkinson's disease, a normal person can walk straight, maybe fast, but the same person with Parkinson's disease may walk little zigzag, may walk little slow. It will track the movement. And that algorithm built in the background, it will tell you your Parkinson's disease rating is maybe you are mild, severe mode. Now think about this. Apple did not develop on their own. They had that algorithm, but they needed somebody to tell, maybe like 10 vibration is equal to mild, 50 vibration is equal to severe. And that information comes from researcher like us. So again, so this is where there are, I think, number of examples coming in. You need to keep human or researchers in the loop. So I think, now this is what probably I know I spoke a lot, but this was my slide. I was referring about artificial intelligence concept. They were developed way back in 1915 in cognitive flexibility, your cognitive ability. And, fast forward, you will see PharmaBot was developed like, pediatric medicine consultant. if my child is not well, which medicine should I give? So there are, I think, this concept, again, as I said, artificial intelligence is not new, but the future research area of artificial intelligence, the way as I see, as the technology is coming in, as I said, domain expertise is extremely important. Your knowledge that you study about human biology, the chemistry is extremely important to teach machines. Second, as artificial intelligence is coming in, there are a lot of areas coming in where the data privacy, how you keep the data protected. There are a lot of talk going on GDPR, the patient privacy. So, and access control. If somebody has a cancer, they may not want to know, they let others know. So how you are going to keep that information secure? And there are a lot of cyber attacks. So those are the emerging areas. So as I said, your domain experience technology, you also need to be mindful about, if you are bringing up something, how it can be secure, how it can be private. And again, it is not a rocket science. When we talk about GDPR, what does it mean? It's like, uh, if I have a medical record, who has that access? Whether that is permanent access, can somebody delete my data? And I think that's, again, I'm making it too simplistic. But if you start learning this, you will understand it is not a rocket science. And this, again, probably I'm going back number of times. It is more of critical thinking, ability to translate, this data privacy, data principles means what to my field. Everyone talks about PII, PHI, personally identifiable information means what? Again, if I ask PII, which is another buzzword used in the US, PII, personally identified information means my name, my date of birth, the place where I was born, that is PII. What is PHI? Personal health record means, my blood pressure. So anything which can associate my name with my blood pressure, that's a private information. How we can keep that secure? And I think those are the research areas, as I see, like coupled with domain experience. So you need to couple the technology, your domain experience, and these privacy principles. So those who are planning to do further research, keep this in mind. And if you find some solutions to that, that's going to be the future. I want to, just show you, I think Dr. Joshi talked about in clinical research, I think, you talked about pharmacovigilance. And, when I go to various universities, everyone talks about, pharmacovigilance as a job. But please remember, pharmacovigilance is just one out of 100 types of jobs. And many times you think, oh, like I'm a pharmacist, will I be able to work in a data management part? Will I be able to work in a biostat? Will I be able to work in regulatory affairs? And I think that this is an area I would like you to go back. Never ever think that because you're a pharmacist, you cannot work in all these dimensions. When I started my job 1996, I joined as a clinical trial assistant, almost like photocopying confidential documents, filing it, sending it to the doctors. Uh, that is where, but during that process, I learned, am I just photocopying this, or am I reading that and there is a new drug coming in, and trying to understand the biology, the ADME pattern about the drug. And then through that process, I ended up talking to the top 10 neurologists of the world. And this is where I have better understanding of Parkinson's disease, what this UPDRS is about. If you talk about psychiatry, young manual rating scale, what that is about. So through that process, you can consider this as an administrative job, but I learn, you interact with those doctors, and the person who is amongst the top 10 neurologists of the world, you can't find in even 1 minute to speak with him in a normal time. And whereas through this interaction, I was able to establish that couple of hours conversation with them, and that was the best benefit. And through that process, I learned. Now here, when I talk about cancer therapy, as a doctor, they're very well versed about the disease. They know how the disease progresses. However, if there is a new medicine coming in, they're not familiar with that medicine. And this is where our job is to educate them and make sure, the development goes across. So I'm quite fortunate, to have worked in all those fields. So again, whenever you think big, never ever think, that pharmacovigilance is the only field for you to work on. You can work on all of this field, including finances. Right now, I am working on a technological transformation. I have myself enrolled into that prompt engineering, context engineering courses on Amazon Web Services, and trying to learn that. It's not a rocket science. This is where, I have translated that knowledge in a simplistic way. When I talk about prompt engineering, you tend to think it's a job of an engineer, but it's not that. Prompt engineering means how you can ask the right question to ChatGPT so that you get the answer, and at the same time, how you validate the answer is correct. So there are a number of roles. Again, these are a couple of slides. India has a huge potential. As I said, every one in fifth person living on the planet is Indian. And lot of, I think because we have young population, talented pool, there are a lot of companies setting up their offices in India, like global contact centers. And what does this mean? This is going to bring more and more job opportunities. If you look at, this is just another article, the Indian pharma market is going to explode by 120 billion, almost like, more than 5 times in the next 4 5 years. Now, that is going to explode. It is going to bring new opportunities. The question is, do you have the right skills, not just degree? So I may be having a B Pharm or M Pharm degree, but do I have the skills? As I said, critical thinking, and that is not going to come by reading textbook. So again, I congratulate the institute like yours, Dr. Joshi, having some of these talks to inspire that you read, yes, you acquire the knowledge, but you also gain those skills, and marry that together to get yourself ready for the future professional potential. And I think you talked about clinical research. So this is again if you look at as an academic student, what I see the gap currently is you have the degree, but not necessarily, I think, and again, sorry to say, because, I say that with confidence. I have studied curriculum of various universities in India, even here in UK, in the US, when I was in Singapore. And I think, unfortunately, those, you will see on the right hand side, if I talk about clinical research, it is not about working in the lab, the management of clinical research, the regulations, talking about, 5 eye analysis or, Kaizen principles. And I think some of that is not necessarily taught in the way industry needs. And I think that is the gap. And my sincere request to you, you don't need, this is something you can learn on your own. And in my own ways, I will just end here. Dr. Joshi sir talked about, the BSCR as an organization. So every Sunday, it's my habit. Sometimes people call I'm a crazy or idiot. So I wake up at about 5:30 in the morning, and I teach some of these pharmacy graduates on some of these life skills, you can say. What is not necessarily what you have studied in the university, but it's more on, it's almost like a certification course with building, good clinical practice, what it is about. What do we mean by GXP? And, through that process, my idea is make sure, people start understanding what industry is looking for, in addition to what you get to learn into the study. Even it is as simple as I said, I may not be good in English, but am I able to communicate my question to a doctor? And sometime during that process, you will also learn there are people, and it's my own example. Probably Parvati will attest. Uh, when I joined this company 30 years ago, I used to be afraid of taking a phone call. We used to have desk phones that time, because if people from the West or US would call, will I be able to understand their accent? Until I learned, a person from France and Germany, they had huge difficulty in communicating, and then I really learned that my English is not that bad. Yes, my accent is different, but don't again. I think this is where, talking about the soft skills, how you thank the same person more than once. If you're upset, how you write the email. And I'm sure, probably Parvati will talk about that in the next session. But, this is what, another area. So again, I think, that's my last slide. So again, please take the screenshot. I think, Dr. Joshi sir has the link. So in case you have problem with scanning screenshot, what I need, I would like you all to spend 3 4 minutes, click onto the link, provide your feedback. How you find today's session? Anything I can do better? Because I conduct these sessions almost 1 2 sessions every week, and those sessions are right for the students who are doing PhDs or the ethics committees. Too, like a couple of weeks ago, I conducted session in the school talking about how the medicine works. So it's, I take every feedback as a gift. That's how I improve. And my last parting message, again, probably I can't emphasize, don't ever think, that you have a degree, that means I can stop learning. Be always curious. I'm not saying learning means, you apply for a new course. Try and understand what is happening and then see how you relate to your area of expertise. Uh, Never ever stop learning. And, even at this phase of my life, I'm learning, as I said, I joined this, courses on prompt engineering, artificial intelligence. I was reading the book on AI Summit, which is happening in India. I'm going to read, some of the new policy which has come, produced by the Indian government. And I think that is what you need. So once again, I know I spoke a lot, almost like hour and 10 minutes. Hopefully I have been able to, inspire some of you to think outside of the box and see in which way you can contribute not to your own professional development, but to the wider community. And I think this is a profession, why I'm doing this, it doesn't, actually, I'm quite passionate about it. There is still a lot of unmet medical need, and it requires that human capital. And I hope, some of that human capital is you, and you will be able to find some cure for some of those diseases that we talked about. So once again, thank you, Dr. Joshi, sir, all the dignitaries at the Anuradha College of Pharmacy. I am actually visiting India next week for another conference on the 28th of February, which happens to be a National Science Day in India. We celebrate in the living memory of Dr. C.V. Raman. So I would have loved to come, but I have a few other commitments. But definitely love to visit the institute in person in the near future. So once again, thank you very much, Dr. Joshi. I still have about 10-15 minutes, so if there are questions, happy to answer. Otherwise, giving back floor to you, Dr. Joshi, sir.
Thanks a lot for your inspiring talk, sir. When you began your talk, you used one word, and that was the only key that inspired many of us. And you said that very naturally you said that I enjoy what I am doing.
Yeah.
I think that is the key which will motivate every one of us to take up to the new tasks of AI and ML. Just one small technical question, sir, before we finish up.
Yeah.
What role may AI possibly play in personalizing the therapy?
Yeah. So this is a really, really interesting question that you asked. And I have my another talk. In fact, this is what, on the next Saturday. But I'll tell you, in terms of, if you think about, I think I just gave you example of the protein structure. It's one dimension. But if you think about, and I think this is where the more I think, if you look at the research activity, the new medicines which are launched into the market, and I looked at the data for the last 50 years, all clinical trials conducted. And again, I'm not referring to one specific disease. And if you look at the data and understand the number of patients participating in those clinical trials and what was their ethnic origin, you will be surprised. 80% of the population participated in clinical trials, they have the background of white or Caucasian origin.
Okay.
Now, just think about, and this is horrifies me, the drug which is researched on the 80% of population, when it comes to the market, is consumed by the people who were not part of clinical research.
Right.
So, the way, as I see, like, somebody in the US, their eating habitats are different. Maybe, somebody smokes. Their genetic patterns are different.
Right.
So naturally, the drug is going to behave differently. And therefore, I think, I feel sad, many times people say like Indian patients are used as a guinea pig. It is not. Somebody needs to be part of that research. As I said, probably like in ideal world, if there is a research, I would like to see in any research, 20% patients are from Indian origin, because that's the representative population of the world, every 1 in 5th person. And especially in the diseases like diabetes, which has, if you look at the world's diabetic population, majority of population resides in India. So in such clinical studies, I would like to have even more population. So coming back to your question, I think this is very, very relevant. AI
Right.
has a role to play. If you study your genetic pattern, if you study your biology,
That was what I was pointing
yeah,
to.
yeah. And so for example, again, I'm making it too simplistic. When paracetamol was researched, maybe 50 years ago, somebody decided 500 milligram is the right dose. Now, are you really sure? I may not need 500 milligram because, I don't drink. Probably I don't smoke. I eat vegetarian food. So for me, probably maybe 250 milligram is enough versus, somebody who drinks, smokes, overweight may need 1,000 milligram. And I think this is where I think the future is not that far. If you combine these parameters, you can actually personalize medicine,
Yeah.
for, you doctors, and maybe I'm sorry, I'm just making you another example. For you, it may be 250 milligram. For me, it is 1,000 milligram. And this is where like concepts like 3D printing technology coming in. You personalize medicine based on the need. And even science is going ahead, if you combine all this parameter, can you predict what's going to happen? And this is where a new concept is coming in preventive medicine. So there is a horrifying statistics. If you spend 1 pound on preventive medicine, it can save 14 pounds in the future. And
Okay.
you can
That's right.
use that 14 pounds to develop new medicines where there is no cure available yet. And as you rightly said, I think this is where I would strongly recommend precision medicine, personalized medicine, 3D printing. These are the areas where if anyone wants to sort of research, it has a lot of potential.
Okay. One more for our students, sir.
Yeah.
If the students from BPharm who complete the graduation or post graduation, what path they should take now?
Yeah. So I think, this is again, I'm glad you asked that question, Dr. Joshi sir. And many times, right now, my son, I'll give example of my son who just completed his engineering a year ago. And I think his first question, he said me, Baba, in Marathi. So you took 30 years to reach this far. How I can reach this in 5 years? So this is, I think, the way Gen Z thinks.
Thanks.
They are aspirational, and I'm very happy. It is good to be aspirational, but at the same time, be pragmatic. My advice is, do your research correctly, and just don't do the job because it will give you money, fame. Quite honestly, when I joined this profession, the clinical research was unheard of in India. But I realized that this has and my father told me, till the time there is life on earth, research will be required. And it stuck me in my mind, and it developed that passion. And I think over a period of time, I made my passion as my work. And that has made that huge difference. And as a part of that, I got to travel to these countries, or I got to stay in those 5-star hotels. I got to meet those top 10 neurologists, psychiatrists of the world. And yes, but I did not join this because of that part. So what I think, my request to also do your homework. Maybe some of you may be a good teacher. There is nothing wrong in doing that. Find out your sweet spots, where you are good at. And once as an example, yes, probably I heard Bao talked about, now he reached there. And as I said, my son, yes, it is good to aspire, maybe if somebody took 30 years, how I can do that in 10 years. It is good to us. But, while you do that, make sure where you are currently, where you want to go, and find out the gap. And then start thinking out how I can fill in that gap and work on that. This is a good time for you. So again, I'm translating that. Maybe you think you need to improve on the communication. You don't need to go through courses and learn about that. Simple things like watch the English television news for 5 minutes. Communicate with your colleagues in English. Write an email. Ask somebody to check it. Or so I think these are simple things. And if you talk about critical thinking, you don't need to go for the classes. You just ask. If you look at that Kaizen principle 5 why, ask the same question 5 times and you will get the answer. So the first answer you get is not the right always. So again, think when choosing the path, there are a number of opportunities, as I said, in India, abroad. And by even I think Dr. Joshi, we talked about right now. If you look at the sub-Saharan or those Gulf countries, there are a lot of research activities started moving in that direction as well. Because if you look at the population, India, China, and Indonesia, these are the top three populous countries of the world,
Right.
and they constitute about 40 to 50% of world's population. That's one area. But if you look at additional unmet medical need, that's the Gulf countries, sub-Saharan part, that's another area coming in. So, this is where, majority of activities are happening. So just think about that. And even as simple as, my younger son now, who wants to, sort of look at the technology, and he has found out he wants to study automotive. And then he looked at maybe German is a good, now though, like, we live in UK, he has started studying German as a language in his year 10. And then what he found, if you have German language, if you study in Germany, because that's where a lot of research innovation is happening. So I'm giving you a few examples. So I think there is no right answer. My only request to you all, do that homework. Once you do the homework, be aspirational, saying that I want to do that. And once you find the gap, find out how you're going to fill in that gap. Maybe it is communication, maybe it's soft skill, as Dr. Joshi talked about. Somebody says, I want to join clinical research, but there is some course that you are coming up with. So let me acquire those skills. And I think most important part, I would urge all of you. One of the area which I learned in hard way in all my career, I was not expressive enough. Though I knew a lot of things, I didn't know how to express. And it took me some time. And I realized, if I had some of this lecture like this 30 years ago, I would have progressed even quite further ahead in my career. I learned it in a hard way, despite some of my teachers were saying, go and just go into the library. That time we were not having internet, read newspaper. My father used to say that. And I realized, there were a lot of great ideas I had in my mind, but I was not able to communicate that. At the same time, I was lacking that confidence. Will I be able to speak with my boss? Will I be able to speak with a vice president in my company? And maybe will I be able to speak one of the most senior scientists and challenge, some of the way of thinking? Now, when I say challenge, that doesn't mean, in a negative way, but having that healthy debate. I learned that, on the job, the example that you gave about Indian Institute of Management, Ahmedabad, how you communicate, how you put point across, and at the same time, how you can be assertive. I'm not saying arrogant, but assertive, at the same time polite. I think these are the areas I would strongly request all of you. Always remember, and I think you will find difficulty. Always you will feel like, maybe my English is not good. Usually I do, I stand in front of mirror and I speak, and sometimes it looks horrible. And sometimes I record my own talk and then listen to that, and you realize like how bad you are. But accept that, and I think that's the part of journey. Spend time on that. You have that time right now. Once you get into the job, you will find it very difficult. So I know that was a long answer to the question, but I would sort of say, don't limit yourself, just for one career. As I say, like, when I started with the question, which the company we want to work for, and you said Cipla, Dr. Reddy's. Nobody talked about international companies. Nobody talked about Google. So, even I would like to think when my, father, never thought of, I will travel internationally, I will settle in another country. So the way I would like to think, I won't be surprised, the next generation starts saying about, now we say, okay, my son lives in US, so I'm traveling. If 10 years down the line, you say like, no, my son lives on Mars, on Moon. You don't know that's going to happen.
Quite possible,
So
quite possible.
yeah, sky is, we say like the sky is the limit. I would like to say sky is not the limit for you, the way you think. And if you put that mentality, I don't see, why you should not be able to achieve the success for you, for the country that you work for, and for the larger community.
Thank you. Thank you very much, sir, for this precise answer. A similar question I find in the text box, chat box. Sir, if you were a pharmacy student in 2026, what would you focus on to build a strong and successful career?
I think, if now again, I'm just going back as a 2026, and this was precise answer I gave to my son. And right now, he's a mechanical engineer, and basically most of the students, here, they do not, they want to have a desktop type of job. So, maybe I can work from home, and probably like start earning a nice salary. Uh, if I'm a 2026 student, I would want to get a solid ground experience. And what does that mean? If, let's say, I want to bring a cure, maybe a transdermal drug delivery system, I'm just making an example, 3D printing. I would really start looking at what the 3D printer is about. Now, I have my 3D printer here. Actually, this is where, my son, started making, use of it. But, learning. So when I say that, try, start from that ground level up. So again, translating, my son is right now working in a paper tissue manufacturing company as a process engineer. But every day he works with the machine, from where the raw material comes in, whether that raw material is of right type. There is machine breakdown. And then we say like the machine breakdown because there was a lot of pulp going in and it clogged the pipe. Now, why did it clog? Was that because it did not clog last week, but it clogged now? What was the difference? And because he was on the shop floor and he had better understanding, the kind of wood which was used a day last week and this week, the thickness of wood, the material of wood has different. This was much thicker, so probably the flow of that material should have been slower compared to last week. So why I'm giving this example, because I think that this is where, if I'm a 2026 student, I will try and ask those why question. 3D printing, why I have to use that 3D printing? Is there something better? I'll give, maybe if I'm 2026 student, very recent example. In the US, they are talking about in the next 4 years, everyone should have a wearable watch. Basically, watch we can detect your pulse, heart rate, and that's the concept of the digital health technology. If I'm a 2026 year student, we have 1.4 billion population, and even if I translate that 1.4 billion population times, say, what cost about 5,000? Do I want to invest, or do I want to recommend Indian government invest in that, or do I develop something indigenous, which is much cheaper? I do not have to follow just because somebody else is doing that, because their needs are different. And I think so that's where probably I will come out of the textbook. I will use my textbook knowledge. I will interact with people like Dr. Joshi, sir. I will try and get that knowledge, but in some cases you may not have knowledge, and with your help,
Right.
I will get some introduction. Okay, can I speak with Bhav Sahib? Or there was a talk. Can I speak with Parvati? And then find out what I can do, what I can learn, and I will start acquiring those additional skills, which not necessarily give me a degree, but will give me the knowledge. And be confident when I sit in front of an interview. I will be able to express that much better than what I would have done 30 years ago.
Very rightly said, sir. It was really amazing, and we don't feel that it was 1.5 hours was enough to have your discussion with you. So it was really an amazing and contemporary talk. More and more we have to explore from your side, sir. So it is just a beginning, I think. It is not an end of your session, although it's the end of your session, but this is a beginning that we will have Bhausai Patil as a member of Anuradha Group of Pharmacy Institutes, I think. And so at the outset, I would like to thank Honorable Bhausai for accepting our short invite and sparing his most valuable time over here with us, with our students, with our faculty. Much more we are expecting in future as well. So my words are very short to express my gratitude towards you, sir. So once again, on behalf of Anuradha Group of Pharmacy Institutes, we express our sincere thanks. We are also grateful to our management for encouraging us to arrange such events for our students, such programs for our students. I would like to mention specially Dr. K.R. Viadi, sir, who is the campus director of all the 4 institutes, who always directs us in the most appropriate direction to take our students to the proper goal wherever they are designing. I am also thankful to Honorable Principal Dr. R. H. Kale, sir, Honorable Principal Dr. R. R. Pagore, sir, Honorable Principal Dr. Gopal Bihani sir, all faculty members who are with us during this program. And nevertheless, I will also thank my students who are patient and participatively they have enjoyed this session. With the permission of the chair, I declare that this session is over. Although we don't wish to declare, but Gausab sir also has to has many commitments and he has to follow his office. Sir, the link will be shared. It's already shared in the chat box. Again, we
Sure.
will share it in the WhatsApp group. If anything
Yeah.
short is there, you can let me know. We will recirculate it.
Yeah, no problem. And then this is just for my own purpose because, as I
Right,
said,
right,
I'd
right.
just like to see how I can do better
Yeah,
in those
yeah.
next forums. So thank you once again. I think really pleasure, and I'm sure, I think as you rightly said, this is not the end, but probably end of the new beginning.
Right. Thanks a lot, sir. Thanks.